Okay, this week we're going to be doing views of the femur, the pelvis, and the hip. So to start with, we'll have a AP femur view. With this, the central ray is going to be directed right about here, and you want the bottom of the film to be 2 inches below the leg. Just as a reminder, we want to ask the patient to remove anything in their pockets that could be metal or that could be obstructing the film. We also want to ask them to wear a genital shield here, especially if they're pregnant, which you probably wouldn't do x-rays on. But also, this view here is done with a 14 by 17 film. So again, here, central ray is directed here. We're going to collimate, this is distal, yeah. We're going to collimate the knee joint and as much as the femur as we can. The next view is the lateral lower femur view. So you're going to kind of pull your leg over to the side, like so, with your knees slightly bent. Again, we want the lower border of the film about 2 inches below the knee, but this is going to be a 10 by 12 film this time. And the central ray is going to come in right about here. And we're going to collimate the knee joint again, and as much of the femur as we need. So those are the two femur views. Next we have the AP hip view. We'll be right here using a 10 by 12 film. And it's going to come right about here, the film itself. The central ray is going to be, I think, an inch. I think it's like an inch away, medial to the ASIS. So, right about here, that view in that box there. We're going to collimate as much of the structures in that area, mainly around the femur head and the hip joint itself. Definitely the proximal femur as well. Next, we have the frog leg view. You could do this bilaterally with a 14 by 17, or you could do this unilaterally with a 10 by 12. And this is kind of like frog view, frog view is more like kind of like I think you said Captain Morgan's. So you're going to kind of stand like so. You can rest your knee, or your foot, on your medial knee here. The central ray is going to be between the ASIS and the pubic symphysis. So probably right about here. And we're going to collimate all the structures there in that area. So as much as we can of the proximal femur, the hip joint, and, hip joint. Let's see, now we have pelvic views. We have an AP pelvis, which is that's a 14 by 17 because it's bilateral, so you're going to be coming here, and you're going to have the central ray directly at above the pubic symphysis. Again, the patient will be wearing a shield, but that way we'll be collimating all of the areas of the pelvis, lower lumbars, and sacrum, and the proximal ends of the femurs. We would do this also with the inlet and an outlet view. For the inlet view, I would be laying. I'm going to have to do it standing because this is the best way to demonstrate it. But you would be coming down at a 45-degree angle, or caudally, yes, it's this way. So yeah, 45-degree angles, and you'd be, again, at the same area, the pubic symphysis would be your center. And for a outlet view, we're going to take that and flip it, and you're going to have about a 20 to 30 degree tilt for guys and a 30 to 45 degree tilt for females. For this one, I think you are a couple inches below the pubic symphysis. So be here, coming directly up into your body. And the last one we have is the Judith method. Again, 10 by 12, no, this was a 14 by 17 film. You're going to rotate the patient when they're laying. Now they would have like a wedge or some kind of support underneath them, or they could take their leg and kind of fold it over their lower one. Doing so, we want to leave here. The central ray is going to be right around below the ASIS, in between the pubic symphysis. Coming here, collimating a superimposed division of the proximal femurs, but however, well, kind of sort of, they'd be more so superimposed at the bottom. So not so much superimposed here, but you will have the collimated views of the oblique pelvis, oblique hip, and an oblique lower lumbar in sacral view. And I think that is I think that's it for this week. Thank you. Appreciate it.